Beauty isn't all about a luscious set of lips or rock-hard abs. Your brain looks for more subtle clues that indicate whether a person is healthy.
Right. External beauty is only part of the whole picture.
Even before MRIs and blood tests, our brains could sense authentic beauty in a fraction of a second.
Because authentic beauty reflects health.
Our new book will not only help you look your best, but also feel your best. Because when you feel good, you look good.
It's all part of you being beautiful, inside and out.
I'm Dr. Arthur Perry.
And I'm Dr. Mike Roizen. If beauty is in the eye of the beholder, almost 12 million people think they are not beautiful, because that's how many people had cosmetic surgery last year. Who better to talk about this than our partner and a pro, Dr. Arthur Perry?
Much cosmetic surgery is performed to restore your prior appearance. And that's your appearance before you grew old and before your pregnancies. Well, people who have had that type of cosmetic surgery, well, they just want to look like they used to. But there's a whole group of people who simply never liked what they look like. Those are the people who come to me to have their large noses made smaller and their small chins made larger. And also their protruding ears tucked and maybe even their lips made larger. Well, they're the people who have their breasts made larger or smaller, Mike. And they have fat suction from all over their bodies with interesting instruments that look a little like this, Mike. Most people, they just want to look average. That's right, average. Just like everybody else. Most people just want to fit in. They don't want to stand out because of their looks anyway.
To stand out, they wear interesting clothes, dye their hair, or pierce something. But they want their features to look just like everyone else. They want to be normal. Cosmetic surgery can change personalities. It can make you happier. Introverted 16-year-old girls with large noses or ears that stick out,
like this patient that we have here, well, they become extroverted, Mike. Their personalities change before my eyes. You know, cosmetic surgery can do in 2 hours what it might actually take years of psychotherapy to do. You know, facial proportions, they're very important in defining beauty. And just like the geometric patterns in butterflies and beautiful seashells like this, well, our faces and our bodies, well, they follow some very interesting mathematical rules of nature.
When the proportions of our faces are off, even a little, we look less attractive. The further we look from normal, the more difficult it is to find a mate. The subconscious message of ugliness is infertility. If you're beautiful, you're less likely to have mutations that will interfere with fertility.
Well, the message 10,000 years ago, well, that was if you're beautiful, you're more likely to have many healthy children. So plastic surgeons change the body so that we look like everybody else. Now, ethnic noses, well, they can be made to look a little less ethnic with the help of what's called a rhinoplasty. I love that word. Rhinoplasties change the size of the nose just a little, and here we have a photograph of someone that had one. Now, a bump on the nose, just a millimeter, and a millimeter is really just about the width of this pencil point. Well, a millimeter can be seen from across the room as a bump on the nose. The changes that plastic surgeons make are measured in fractions of millimeters, and that's really the most difficult procedure in plastic surgery, and to be honest, it's the most artistic. Well, now that's different from, let's say, cosmetic breast surgery, because that's an operation that's measured not in millimeters, but inches, Mike.
And cup size.
And cup sizes, that's right. Well, most women really just want to be average. You know, interestingly, our view of beauty does change over time. 300 years ago, if you were thin, you were poor. Only the well-to-do were overweight. And if your skin was smooth, you might not make a good mate. Now, that seems paradoxical, but that meant you didn't have smallpox yet. And survivors of smallpox, well, they had pock-marked faces. And as only milkmaids actually had smooth skin hundreds of years ago because they developed a milder form of smallpox from their cows. In the cosmetic surgery era, bad cosmetic surgery has actually become desirable. And this is one of the things that actually amazes me about my field. Well, in the 1960s, if you had a scooped out nose, well, that meant you could afford cosmetic surgery because scooped out noses, they don't occur in nature, but yet plastic surgeons were making those. In the 1970s, it was the poor breast augmentation that resulted in breasts that were visible just below the collarbone, and I've actually had patients ask me for that look, but that doesn't occur in nature either. Now, many of you have seen women in, well, those magazines. Maybe they want that Playboy look. And if that happens to one of my patients, I consider it to be a complication, a poor result. And think again of eyebrows that have been lifted halfway up the forehead. Again, Mike, it doesn't occur in nature, maybe on an alien species, but certainly not on Earth.
How about faces so overdone with Botox you can't tell if they're happy, mad, or sad?
You just have to see the Emmys to see that one.
Or my favorite, those lips that are made so large they look like Placo fish. Plastic surgeons must have an artistic sense. Isn't that true, Arthur?
Absolutely. If you're a klutz, you're not going to be a plastic surgeon.
And must be willing to turn down people who request unnatural appearances. Scrupulous ones will do just that. When you have a consultation with a plastic surgeon, besides checking out his or her credentials, ask to see photos of prior patients. Every plastic surgeon takes photos of his patients. If every nose looks the same, expect yours to come out the same way. If every breast implant is too big, expect yours to be too big. If your plastic surgeon is willing to take excessive risks with your health, find another one.
All right, Mike, we're going to do a little Botox today. Now, it's been several months since your last Botox procedure, right? Do you remember when that was?
Well, we only do it in green rooms, right, or during recording sessions. So the last time, I think, was at GMA in June, so...
I think so. So we're about 5 months or so. Let me see that line. Go ahead. Bring the brows together. Oh, this is an emergency. We need to do this fast. So I'm going to clean... keep your glasses off now. That way you won't see the blood. I'm kidding. There's no blood. Relax. I'm going to clean your forehead off with a little alcohol here. That'll kill some bacteria. Let's go ahead and put this on. And that's going to constrict some of the blood vessels on your forehead, and it'll actually make it feel just a little bit better. While you chill your forehead, I'm going to draw up some Botox. So we're going to give you 15 units of Botox, Mike, and that's enough to kill 15 mice. Which is true, because 1 unit, the measure is, 1 unit can kill 1 mouse. That's how Botox is measured. But you can withstand many, many hundreds of units, so not to worry. And let's take a look once again at those wrinkles. Great. Okay, you ready, Mike? Mm-hmm. Okay, here we go.
Ow!
Oh, don't do that to me. This doesn't hurt. You know, the listeners out there and the viewers are really going to be, they're going to be concerned that I hurt you. And I would never hurt you. We do a radio show together.
You may be the only host this week.
Turn your head this way. Okay, now, hang on a minute. Okay, I want you to bring your brows together. Relax for a minute. Bring them together. And what I'm doing, don't move. What I'm doing is looking where the muscle inserts into the skin. Got to bring them together. Relax. The left one's a little weaker than the right. You probably still have some residual effect from your last Botox there. Now let's look at you. Relax the muscle. Relax. Is it relaxed? Mm-hmm. Boy, you needed this. Okay, go ahead and frown for me. Okay, hold that pose right there. Relax for a minute. And this is the art of Botox, Mike. Do that again. Bring the muscle together, okay? Seeing exactly where the muscle inserts into the skin. I'm looking for where that muscle is pulling. And I'm giving you some Botox right in that spot. And that way, the muscle won't move. Those wrinkle lines will go away, and the world will love you again. Now, Mike, you've got some horizontal wrinkles across the bridge of your nose that I'm going to treat now also, okay? So, because you want just a little bit more punishment. We have to make you look good, okay? And we're all done. And that's it.
Thank you.
You're very welcome. Could you get the defibrillator, please? We're going to let you sit for just a few minutes. The protein in Botox fixes to the muscle in just a few minutes. We don't want you to exercise for about an hour or so. You can go about your business this evening. Okay?
Thank you.
You're very welcome. The Botox will kick in anywhere from 2 to 14 days, and it will last anywhere from 2 to 6 months. However long it lasted last time is probably what it's going to last this time.